Hi, if we can begin. So I'll just introduce myself. I'm Deepa Sinha. I used to teach at the Ambedkar University, Delhi till recently. Been with the Right to Food campaign since the campaign began and worked with Biraj at the Supreme Court Commissioner's office also for a very long time, like he mentioned. Um, Biraj is kind of, maybe it would have been better if I went first because many of the questions are sort of what hopefully should come here. Some of it is already addressed. Google proportion of vegetarians in India, those maps come up. In most states in India, except for 3, 4 in the western part of the country, majority of populations are meat eating populations. So this, it's not some Indian tradition of vegetarianism that is being seen here, but the fact that it is not affordable or other reasons. And there you see a gender gap as well. Like I was saying, women's status is an issue. Again, women's employment, we don't have time to go for discuss that, but women's labor force participation being very low in India is one of the indicators of women's status, which has been very poor. But you do see some levels of increasing education, but ownership of property, having a mobile phone, even 10 or more years of schooling, because here we are looking at mothers. So only 41% of the mothers in the National Family Health Survey had more than 10 years of schooling. The other issue is sanitation and water. And even there, while we see improvements, there is still quite a bit of a gap. So households using clean fuel for cooking, for instance, is less than 60%. And here again, we don't know if it is exclusively only clean fuel. They might be using that as well as firewood or cow dung. And this again has implications for women's time, but also a lot of research that shows that indoor air pollution because of using unclean fuels has a huge correlation with nutrition outcomes. So these are all the health, sanitation related drivers of malnutrition outcomes in India, which we are not going into very much. Another point again, which came up in your questions and discussion with Biraj. So broadly, drivers are stuff that drives health, infections, and what drives feeding. But one big driver in India on where you stand in terms of your food security is your socio-economic, gender, geographic location. And whatever little data we have again shows that there is a gap there. So if you look at any sort of indicator, I've just randomly put a few here. For instance, if you look at dietary diversity scores, percentage of women consuming 4 or more food items on a regular basis, you see this ranking. You will have the Dalit Adivasis consuming less than the upper castes. Improving for everybody, but the gap remains. By income and wealth, clear gradient. If you look at stunting, the richer quintile the child belongs to, lower is the rate of stunting. So amongst, still high, but amongst the highest quintile in NFHS, 22% of children are stunted. Amongst the lowest quintile, it goes up to 51%. And everything, all the other sort of indicators as well, if you look at anemia, if you look at the proportion of consumption of these food items, the regularity, all of that you see are quite closely linked to the wealth quintile. It's not very good income data, but this is what the asset quintiles is what NFHS gives you. By wealth index, I think I've missed the, yeah. If you look at it by caste, tribe, again, clear gradient. And these are just basic descriptive statistics, but even if you control for income, you see that a Dalit child is more probable. It's the probability of a Dalit child being stunted is much higher than an upper caste child, controlling for other factors as well. And you, again, it's very clear. It's not some confusing trend here. Same with adult women. The proportion of women with a height less than 145 centimeters is highest amongst Dalits, followed by tribals, and lowest amongst the upper castes. So one driver is really your caste, social location. It has affects in so many ways in terms of people's access to property, people's access to livelihoods, people's access to public services as well. I mean, we talked about midday meal cooks in the morning. Also, what foods become taboo and what foods are acceptable. And we see a lot of that in India now. So for instance, beef consumption, it is the protein of the poor. It's the protein of the Dalits and the Adivasis. There was one example I always remember is there was this story, again, it was a progressive story done by a sensitive journalist about hunger in Jharkhand. But what the case study they chose to portray was that it is so bad here, the situation now, I think it was in West Singhbhum, that they're actually killing wild boars and eating them. Eating wild boars has been part of the tradition of those Adivasi communities for very long. It's a good source of protein. It is not at all something, it's great that they are able to do that. So this whole idea of what food is, again, in the context of India, there are notions of purity, there are notions of what good food is, which is very closely related to Brahmanism and the way caste is, and it's food practices very closely linked to caste, right? Not just in terms of untouchability and an upper caste person not eating food from a Dalit household, which is of course there, but also in terms of defining what is good food. And therefore, how did that then influence even public policy? So another friend and mentor of ours, Dr. Veena Shatrughna, who used to be the deputy director of NIN, often argued how in the 60s, when these programs were being put in place, the nutritionists who were making the diets and the food baskets were all Brahmin. And therefore, in their imagination, calorie density came from where? It came from sugar. Right? And for protein, they couldn't think beyond dal. Not because they were actively being casteist, maybe, but that is the food they knew. Or even now, if you see these opposition to introduction of eggs in midday meals in many states, if you look at those pamphlets that people come up with, they will say there are alternatives available for animal protein. You don't have to eat this. What are the alternatives that are being suggested? No. Soya is anyway not at all indigenous in our diets, and it's heavily processed, many issues. Sattu is not enough, but sattu is a good source. But badam, right? Almonds. Now, what is the cost of almond vis-a-vis the cost of an egg? Chalo, forget cost. How many almonds does that child have to chew? We're talking about a 2-year-old child. Vis-a-vis eating a boiled egg. Right? So many of these, if you just go by the numbers and say per 100 gram almonds, how much protein vis-a-vis per 100 gram eggs, almonds might do quite well. But eating 100 gram almonds vis-a-vis eating 100 gram of egg itself is a very different experience. And then, of course, there is cost and there's everything else that comes into it. So the whole food policy, the idea of food is quite linked to caste. And that's a big issue and big driver, other than also in terms of these cultural norms, but also in terms of access, economic access, because we know that economic status is also quite closely linked to caste status, so access to land, access to even commons. And we do know that even in commons, the best trees and the best pond locations are controlled by the upper caste. It's only you have to go to the edge for the Dalits to be able to access it. So that is one big driver that I wanted to emphasize. The other, of course, is gender. And gender, one way in which, when we're thinking about it in terms of policy and even conceptually, one way in which where gender discrimination is a little different and one needs to approach it differently is that this is within the households. So no hierarchy in terms of is caste discrimination more than gender discrimination, but that one is intra-household. You're also talking about within the household, within members of the family, distribution of work, distribution of food. And part of this food equity project, they have some interesting findings on intra-household distribution, sharing of food and work and so on. But you do see that all of this then comes out in the data that we see as well. Again, in food consumption, you see that in little children, there's not a big difference. But as children grow up, in adolescence, you start seeing these differences. Where again, especially in consumption of non-vegetarian items and so on, adolescent girls being behind boys, and then you see it in terms of outcomes as well. But in terms of stunting outcomes and so on, you do not see a gender difference. But as the age increases, anemia, of course, women are much more anemic than men are. And heights as well. In India, you see that although heights of men and women are increasing as time is progressing, the rate at which the heights are increasing is faster for men than for women when you compare to other parts of the country, other parts of the world. And finally, India is one country, but there are many countries within, in many ways, even in terms of food security, access, and nutrition outcomes. If you just take by rural, urban itself, there's a big gap. Again, we would imagine that in rural, trees are in abundance and people must be eating fruits all the time. That's not the case. Actually, the data shows that it's actually more in urban, because again, there is changing economics of these things being available for free as well. But overall, the malnutrition outcomes are also worse in rural areas, or have it by gender. So everywhere you see these differences. So women, so even in terms of states, big difference within India. Just one example I have here is comparing Bihar and Kerala. So if you look at the proportion of stunted children, 48% in Bihar in the same year, only 20% in Kerala. Right? So again, when we later think about one reason we are looking at drivers is also then look at where policy intervention should focus. Obviously, it can't be the same thing in Bihar and Kerala. Just at the outcome level, there is such a big difference. 18% women in Bihar are too short. The stature is too small. Kerala, it's only 5%. Food consumption, again, you can see that women in Kerala are able to access these foods many more than those in Bihar. This just took two states. You can compare Uttar Pradesh and Tamil Nadu. You can compare Bihar, Uttar Pradesh, Tamil Nadu, Kerala, Karnataka. Broadly, we see a north-south sort of division. But the interstate differences are also quite big. So the nutrition status of an individual child or adult in India depends very much on the accident of birth. Where you were born, which caste you were born into, of course, what is the income, livelihood, wealth status of the household, what gender you are born as. All of this determine greatly what your outcomes are, along with, of course, agriculture and so on, which I will talk about. But before that, I did want to point out that when we talk about drivers of food security or malnutrition outcomes in India, there is no one India. Unless we disaggregate the data by all of these, one doesn't get a true picture of what the situation is, because the differences are quite wide. And these are not some biological differences. These are differences created by social norms, and they are basically differences because as a result of discrimination, most of them. Maybe this regional is not because of discrimination, but it is also very much related to policies that were followed in these different states at different points of time, why some states are doing better and others are not. Even linking to the question earlier about midday meals in Bihar not functioning well, that is not so much a problem of the midday meal scheme as it is of the problem of overall governance in Bihar. Because the same scheme guidelines in Tamil Nadu is doing something very, very different. So those are the underlying determinants of politics and governance and all that one has to keep in mind as well. So having laid that, getting more into food security and agriculture and food availability, Biraj talked a lot about the food schemes and the food entitlements, which are absolutely important. And through COVID, we really saw how if they did not exist, then there would probably have been starvation and starvation deaths. I mean, after COVID, one did not have to justify the need for these schemes. Even a government which actually one of the first policy pronouncements they made after they came to power in 2014 was to say that the NREGA and the PDS were monuments to the failure of the previous government and that they should be ended. One of the first letters that went out from the Ministry of Food to all the states was to say, think of ways to shut down the public distribution system and replace it by cash. Think of ways to reduce the coverage under the PDS. This was 2015. These letters went out, and now this has become the main sort of program of this government. And everywhere, every speech of every politician begins with, we run the largest food distribution program in the world. And that did not just happen randomly. It happened because during COVID, one saw the strength of these schemes, and that this welfare architecture was in place really made it possible to respond quickly to the crisis that became so visible after COVID, where you had these visuals of people queuing up outside these community kitchens in schools, people walking hundreds of miles to go back home. We did that disastrous decision of an overnight lockdown, but then we were able to salvage it to some extent because these schemes already existed. Imagine responding to that crisis where there was no Narega, where there was no PDS, where there is no school meal program, where you already didn't have 800 million people with ration cards. Then you could say, okay, not 5 kilos, we'll give you 10 kilos. You already didn't have job cards for all these households, and then you said, okay, we are opening. If we had to begin there at that time, what a disaster it would have been. So COVID clearly showed it. For those who were not convinced, many of us, we've made it our life's work to work on these schemes. So very important, they provide a safety net. Again, given all these kind of diversities in India, they're really crucial. But that's not all. There is the question of people are hungry, then what are the other drivers and what else do we need to look at and needs to be done? Because also, like somebody asked, just giving rice and wheat is not achieving food security, right? We know that. Therefore, without undermining that, what else do we look at? And there we have to look at the broader food system. And when we say food system, again, just to start with, if you just look at hunger, these are the FAO statistics. I've not updated it for the last 3 years, but broadly, if you look at the trend, you see that after 2016, the proportion of people who are food insecure, moderately or severely, has actually been going up in India, but not just India, across the world for a number of reasons. In India, clearly, other than everything else that I spoke about, what is happening in the last 6-7 years that is contributing to this is that there is a certain distress in the economy, which is not being recognized enough, but there is different data which points to the fact that although it might seem like we keep focusing on India being the 5th largest economy and we are soon going to be the 3rd largest economy, while that is great, that doesn't mean really very much, because India is also the largest populated country in the world. So if we might be the 5th largest economy, but we are 100 and something in rank if you look at per capita incomes, right? Ultimately, what will we do with that GDP? Even if we think that money is everything, it's about how much each gets, not what the size of the pie is alone, right? And there you see that the period after 2017, so it's not just COVID, but if you look at the growth rates, I've not put all the data here, but there's a lot written about it and being written about this all the time. Post 2017, there has been a slowdown in economic growth in terms of the growth rates. The years immediately after COVID, so 22, 23, you see high growth rates, but there's more a low base effect because you had negative growth in 2020 and also 21. So obviously it seems like we are catching up. COVID was really bad, but even before COVID, the rate at which the economy was growing itself has been slowing down, and many have linked this to things like demonetization and the sudden introduction of GST and so on. But more important than overall growth rates, what this has been accompanied with is growing inequality. And we have a lot of data again from official sources which is showing us that this recovery also that's happening is not V-shaped, in the sense that it's not that growth became negative and then became positive. It is that, but it's also K-shaped, in the sense that when this recovery is happening, it is the rich who are becoming richer, while the poor are actually, at least the poorest, there is some evidence to show, are probably becoming even poorer, not just growing at a slower rate, but actually becoming worse. One source of data which is pointing towards this kind of distress very clearly is the data on rural wages. So if you look at the trend, and again, most Indians depend on wage labor, or partly also self-employment, which is very much like casual work. So wage is your main source of income. And if you look at the wage rates in rural areas in real terms, inflation indexed, from 2013, they've been more or less flat, with actually them going down slightly in the COVID years. So that's a huge indicator of distress. And if you just do a simple correlation of the states where stunting actually increased between NFHS 4 and 5, those are also the states where real wages did not increase. You have other data, which is the State of Food Insecurity report, where they estimate the cost of a healthy diet, where you now, with some revisions to the methodology, the latest report shows that about, I think, 55% of Indians cannot afford a healthy diet. How do they do this? They estimate the cost of the healthy diet by looking at local prices and looking at cheapest sources to meet the dietary guidelines as given by each country. So in India, you look at the ICMR guidelines of what a healthy meal is, and then you look at local prices of, to meet this healthy meal, what are the cheapest sources, and you estimate it. If that is more than 52% of the income, then it's considered that you cannot afford a healthy diet. Why not 100%, 52%? Because people have other essential expenditures as well. They spend on health, they spend on education, they spend on other things. So that is about 55% now in the latest 2024 SOFI report. In this context, all these welfare schemes that Biraj talked about, while they play the role of a safety net, their role has in fact been reducing because the schemes themselves are not expanding. So if there is distress, the need is more, you would actually need these schemes to expand. But what we are seeing is that the budgetary allocations are actually coming down in real terms. So if you estimate the budgets for midday meals or ICDS, just inflation indexing using the RBI Consumer Price Index, compare 2013-14 allocation of central government to 23-24 allocation of central government, the midday meal budget in real terms has reduced by 35%. The ICDS budget in real terms has reduced by 40%. What does this mean? What Biraj was saying, then the dal is watery. There is no vegetable in the meal. There is more sugar and less peanut in the THR powder that young children are getting. The wages of the Anganwadi worker does not increase. So on the one hand, the economy has been growing in a manner where there is greater distress. So people are able to afford less in terms of buying from the market. On the other hand, while they are getting some support from these welfare schemes, those are really at a very bare minimum level. So it's like you're in the ICU, ventilator pe laga ke chhod diya. Right? You're not treating the disease. The ventilator is important, no? Till you figure out what is wrong and you do it. That part is clearly not happening. So in the figuring out what is wrong, what are the things, I think if we step back a little bit, you see that there are a lot of uncertainties facing food security globally, but they affect the global south much more, and India definitely. What are these uncertainties? One I've already spoken about is that incomes themselves are uncertain. Where does food come from? You either buy it, you grow it yourself, or you get it through these state schemes. So we're saying state schemes are not doing enough. Growing yourself, most people in India don't own enough land to grow all the food themselves. People, even farmers, depend on buying food in the market. To buy food in the market, you need incomes, real incomes which make it affordable. There one does see increasing informalization and low and stagnant wages. So that is a big issue in terms of what you finally end up eating. Depends on what you can afford, which depends on prices as well as your incomes. And incomes are not growing, and they're definitely not growing fast enough for those in the bottom quintiles of the economy. Along with this, prices are also quite uncertain, and that's where I think the whole issue of production also comes in, where there is this, again, general feeling particularly again in India, that we are food sufficient, right? And we have all this rotting grains in the FCI go downs, so we don't really need to think about production anymore. But that's actually not true when you look at the data at two levels. Firstly, again, I go back to my first slide. If you think of food beyond rice and wheat, we are not sufficient. If you expand it only to pulses and oil, we import, I think, about now 40% of our pulse requirement and about 60% of our edible oil requirement, right? So if we are importing, then the prices are also much more volatile because they're not in our control. So if the Ukraine invasion happened, and Ukraine is a big exporter of sunflower oil, global sunflower oil prices go up, oil prices go up here. And what we saw, the impact of that was in slums of Delhi, we did a small study, is that shops actually started selling 100 ml and 200 ml bottles of oil, which the edible oil companies don't even make. So they started keeping these, or people would come with this size bottle and fill them because that is all they could afford. And this is in Delhi, right? Same with pulses. There are only very few countries in this world which grow pulses. It is the main source of protein in India, and we don't produce it ourselves enough. And this opens up a whole set of issues related to also my third point of this import dependence on why is it that we are not self-sufficient in pulses and oil? Is it that our land can't grow this? That's not really the case. There was a time when India was self-sufficient in pulses and oil before the 90s. And there are studies which clearly show that the whole reforms that came in along with trade liberalization and WTO, in each of these you see how they really contributed to this shift in the cropping pattern. So you have crops like soya in vast areas of Madhya Pradesh, which are mostly getting exported. You have gherkins in Andhra Pradesh. You have cotton, of course, various crops that are being grown. What have they replaced? They've replaced the millets, they've replaced the pulses, they've replaced the edible oils. And this also did not just happen randomly. It happened because we got into an era of trade liberalization, which made our farmers less competitive in certain crops and all the issues related to that. So this whole import dependence is also something that contributes to uncertain availability. And if we're talking about availability, then if we start looking at not just cereals, and within cereals only rice and wheat, then there is a huge issue there as well, which is driving, and therefore it is so unaffordable, right? Because it's not like there's an abundance, and the prices are not entirely in our control. The last one, which is now increasingly becoming an issue, and therefore also why we should not be working in silos, is the whole issue of climate change. So while we have all of this, we also see that production itself, even in the crops which we are quite secure in, is becoming more and more insecure. So 3 years back, there was a heat wave in February, March, which destroyed the wheat crop. So the wheat production reduced by about, I think, 12%, and the government wheat procurement was half what it was the previous year. 2 years back, and even last year in certain areas, there were unseasonal rains, and there was drought in certain parts of the country. There was flooding in other parts of the country in the months of July, August, which affected the paddy crop. And therefore, we saw suddenly these export bans on non-basmati rice and so on. So even in rice and wheat, it's not like you can just sit back and relax and that this is going to be okay. We're continuously having to keep track, and a lot of it also has to do with climate change. It raises a lot of questions on our agriculture policy. Should we really be growing so much paddy in Haryana and Punjab, which is draining water levels? All those sort of questions. That's where I think the scientists really need to help us on looking at what is then the kind of crops that we can grow for our climate and to meet our nutritional needs. Looking at these two together. One last point before I come towards the conclusion is that while we've been talking about undernutrition all this while, Biraj made a mention of this, there is the issue on the other end of the spectrum also when we are talking about food security that we need to start discussing before it becomes too late. So although currently the burdens of overweight and obesity, particularly amongst children, is not very high, it's 3.4% among children, but it is an increasing trend. But look at the adults figures. 24% women are overweight or obese. 23% of men are overweight or obese. And we know that this is an underlying factor for many non-communicable diseases, hypertension and blood sugar and so on. And at some level, there are common drivers also. This is not only a problem of the rich. It's not only a problem of people wanting to be following Western diets and therefore eating pizza, burger. In terms of policy response, we see the same thing happening again, even for this. If children are undernourished, it's because mothers don't know how to feed their children. People don't know what they should eat. If people are now overweight, obese, and therefore getting hypertension and diabetic, it's because people don't know how to eat. People don't know what to eat. People are stupid. I mean, the bottom line is that people are stupid. But like we were discussing in the break also, that's the most convenient driver for any government. Because then governments really don't have to do anything if people are stupid, right? You just have to tell them to be smarter. But if you really look at the drivers, again in India, what are the diets that are leading to these kind of outcomes? Of course, awareness is one part of it. Food environments is a larger question. What is affordable food? It comes back to the same thing. So I don't know how many of you work in urban slums. Again, in Delhi slums, and now even in rural areas, it's not so uncommon to see children eating Maggi noodles as breakfast. Poor children, right? Which will again link to women not having the time to cook. Giving anda paratha is much more expensive than saying, ye lo 5 rupees Maggi kha lo. Or those Parle-G biscuits and Tiger biscuits and so on. So one is, of course, affordability, women's time, also no regulation on this industry. You can sell Parle-G anywhere. Parle-G can claim to solve all your health and nutrition needs. Nothing stopping them. Complan Pio, 6 foot ban jao. Right? No regulation. And all these ads are again not accessed only by the rich. Every child is watching YouTube. Now, the poor child also. And what is the policy that makes these foods cheaper, more accessible, and more attractive than eating an apple or eating sabzi? Right? So this whole question of ultra-processed foods is the other end of the spectrum, but is linked to the drivers of monocropping, the drivers of us becoming import dependent for pulses and oil. It's the same food politics ultimately, that it is a centralized food system where food policies are being driven by big industry and not really by farmers or people consuming the food. So these drivers are what, even as the Right to Food campaign and in terms of research, where one also sees gaps on where much more work is needed. We know these links, but how do we then think about policy? How do we think about more evidence generation? If you actually think about, okay, the environment people work on environment, nutrition guys do nutrition, agriculture guys do agriculture. But actually, if these three come together with a social scientist thinking about gender and caste, then what will your food system look like? And what is the food structure that we will move towards? So food security and malnutrition, linking agriculture and nutrition, most obvious link, but not made in terms of policy. Farmers' income security and affordability of consumers. Biraj mentioned this. This is again a unique global south problem. This is not such a big issue in the West because they don't have so many farmers. 2% of their population is in agriculture, and they're heavily subsidized and supported, and they grow enough. We have still half of our population dependent on agriculture. 80% of farmers in India are small and marginal, they are net consumers of food. But at the same time, they're earning their incomes from food. So they have an interest in both food prices being high as well as low. How will the market do this? You need a system. And that is what the MSP and the PDS system is at its core. That you're guaranteeing assured prices to the farmers. At the same time, you're ensuring that food doesn't become too expensive to the poor. And that currently India is able to do only for rice and wheat. And therefore, that's where we see some stability in prices. In everything else, we see up and down going on. And then, of course, the ecological concerns and economic issues. All this might seem like, oh my God, this is too much and there is no solution, and I'm only pointing out problems, but that's not really the case. It is, of course, true that markets cannot coordinate all of this, because that is not what the objective of free markets are either. So markets can coordinate the most profitable outcome, maybe, which is then called the most efficient outcome. But if equity is a concern, if equity in a broad, if thought about in a broad manner, with gender equity, caste equity, equity over, the even rights of the natural resources over our exploitation, if you think of all of that, then you do need somebody to intervene. I think that it is the state that has to do it, but that doesn't mean that it becomes another centralized system. But how can the state contribute to facilitating decentralization and diversity, that we move back from this overly centralized food system, which is dependent on a few industries, few crops, and commercialized food, to again decentralized foods with diversity is really at the core. For each of these, one does have some specific policy recommendations, which I won't really go into, but broadly saying that as a way forward, one really needs to now start thinking about decentralized food systems, and only then livelihood, food and nutrition security, as well as it being climate sensitive, can be thought about. So bringing the agenda of decentralized food systems into the mainstream agendas, I think that is the next step from now having the PDS and the ICDS and the midday meal. There are a number of ways we can think of these welfare schemes also fitting into this sort of a decentralized food system. So some short-run measures, for example, that one can easily think about is linking the public food programs with local production. So diversifying food baskets, for example, a question that came up. Why should the Adivasis in, was it Odisha, wherever the question came from, be eating wheat? They should get rice. Why should people in northern Karnataka who eat jawar as on a regular basis be getting only rice? They should get jawar for their jawar rotis. There are ways in which these links can be made. School midday meal programs, can you procure locally? ICDS and so on. In the long run, of course, self-sufficiency is also the key. It's only when we have enough will the prices also be stabilized and people will be able to afford it. And when I say self-sufficiency, not just rice and wheat, but across the crops and livestock also would come into this. So I'll stop here, and if in the questions you can ask for details on each of these. Thank you.